Hi everybody, it is your friendly neighborhood handbanger Terry here, and I hope that you guys are doing well. I'm doing well, thank you for asking, because as always, I'm just going to assume you did. This is the video that I told you that I was going to do about parenting a child, son, daughter with special needs. It took me a while to get this video going because I was doing just that. And I'll give you a little bit of history about my particular child with special needs here in a little bit. But first, I want to tell you a story. And you are the main character in this story. Once upon a time, you planned a trip to Italy. It had taken you a few years to decide to go to Italy, but once you decided, you were so excited. And you prepared for months for this trip. You picked out what clothes you would need. You got your ticket in order. You decided where in Italy you were going to go. You were going to go to wine country. You were going to go to Rome. You were going to go to the coast. And you were so excited about this. And you get on the plane and you are just thrilled. You fly for several hours, and then you hear the captain say, "Ladies and gentlemen, we are beginning our descent into Norway." No, you say, "I'm not going to Norway, I'm going to Italy." You call the flight attendant over and you say, "I thought this flight went to Italy." She said, no, it goes to Norway." So you reluctantly get off the plane in Norway and you go over to the ticket agent and you say, "I need a ticket back to Italy." And the ticket agent says to you, "There are no tickets back to Italy." And you say, "What do you mean there are no tickets back to Italy? There have to be tickets back to Italy. I want to go back to Italy." And the ticket agent says, "Nope, I'm sorry. You are on a one-way flight to Norway. That is your final destination," and we do mean final. And you do not know what to do. You have not planned for Norway. You have not packed for Norway. You learned some Italian phrases from an Italian phrase book. You do not know how to speak Norwegian. You have no clue what to do. So you decide to do the only thing that you can do. You've been told you can't fly back. So you wander out into Norway and you look around and you see that it's beautiful country, actually. Not that much colder than Italy. You can always buy new clothes. You buy a phrase book so you can speak to the locals and ask questions. You get a hotel, realizing that eventually you're going to have to get housing. And you try to start making a circle of friends. It's difficult at first because the friends don't understand you and you don't understand the friends, but slowly but surely you learn and you get some friends, and sometimes you find people that also did not intend to go to Norway. They might have intended to go to France or just another country, Australia, but they wound up in Norway. And this seems to be an odd thing. Certain people wind up in Norway. The vast majority of people that get on a plane don't wind up in Norway, but some people do. And that, my friends, is a really good allegory of parents who have special needs children. They did not plan, unless this has been found through testing. But generally speaking, they do not plan to have children with special needs. That was when they decided to have children. That was not in the plan initially. And they might find it out before they get off the plane, or they might find it out when they get off the plane. In other words, before birth or at birth. And it is either way not something that you planned in the beginning. So I thought, I read that somewhere and I don't know where. If you know where that comes from and you want to tell me the credit in the comments, that would be great. But I thought that was a fantastic allegory for how you plan, and what you get is not necessarily what you plan. My daughter C has a couple of special needs. One developed later in her life, and one was present at birth, but we didn't catch it till she was about 4. At 4, she was diagnosed with Asperger's syndrome, which is now referred to as high functioning autism. Which I think is probably a better term for it, because when I needed to explain Asperger's, I had to say high functioning autism. So now we're just calling it what I had to say all the time anyway. She was, from a very early age, able to be fascinated by things for much longer than other children her age. At 9 months old, I could put her in her little exosaucer, and I could turn on Disney's Fantasia, which is a over 2-hour movie, and she would watch every bit of it at 9 months old, not bored, not, and thank you, Fantasia, for the mini showers that I got. She was an extremely content baby. She did not cry, she did not fuss. Apparently she had several ear infections, we found when we took her to get, she wasn't talking, so we were making sure that she didn't have any hearing deficiencies. And she didn't, but she'd had multiple ear infections and never gave any clue to it. So she was a very mild, content baby. She did not cry a lot. She did not fuss a lot. And when she got older, she did not really care if anyone left her, as long as what she was interested in was in front of her. I could leave my mom's house and she wouldn't even look at me. I could leave her at daycare. She wouldn't even look at me. She did not care. She was, as long as the thing that she was interested in was in front of her, she was fine. She was late hitting all of her milestones, and we took her to the doctor, and he diagnosed her with pervasive developmental delay, PDD, which is often a precursor to a diagnosis of autism. So she was late sitting up. She was late she didn't walk until she was about 2.5. She didn't speak until she was about 3, maybe a little older. But when she did speak, she spoke in complete sentences. With Bill and I did not use, my husband and I did not use baby talk with her, because we wanted her to learn, the language as it's spoken. And her vocabulary was incredible for her age. She also, like a lot of autistic children, until they start learning some social skills, was brutally honest, and she was that for quite some time. She walked up to a guy smoking in a restaurant and said, "You're gonna die." I was like, yeah, okay, yeah, maybe not that honest. So yeah, I mean, we got her socialized very early, and that's one of the things that I want to bring up with you is, if you think there's anything going on with your child, they're late hitting milestones, they're not talking, their behavior is a little bit off, go to your pediatrician immediately, because your pediatrician will start the ball rolling. And my pediatrician gave the pervasive developmental delay diagnosis. Then he directed me to an early intervention system in my state. And what that intervention system does is it takes over the care of the child as far as like doctors, and it will pay for specialized daycare, which my daughter had, and I cannot say enough about them. They were a fantastic organization. She learned to walk while she was there. She got lots of socialization with other kids, and I credit that to this day for her ability to speak to people and converse with people. She's still not terribly big on small talk, and she would prefer to talk to adults as opposed to children, which is very common for autism. She also has very specialized interest. Now they change, but when she's in this interest, which she'll have for a few months, she learns everything about that interest. Recently it's been mythology. She can tell you about Greek mythology, Roman mythology, Egyptian mythology, let's see, gosh, Japanese mythology. Before that, it was the royalty for Great Britain. She could tell you really far back, really almost to William the Conqueror, about royalty. Right now, she's sliding back into Disney Ducks. She can tell you who animated them, the comics, before they became cartoons. who voiced them, who voices them now. She gets very deep into her interest, and that's very common. So if you have a child who is maybe not paying as much attention to what's around them and more focused and extremely focused on one thing, that's another thing that you might be watching for. So you have this child, and this child has been diagnosed with a special need, and this child is going to go to school. And I realize that doesn't really apply right now because there's a lot of cyber learning and that kind of thing, and that is a little bit concerning for children with special needs. But in a normal school setting, if your child is beginning to struggle because of a learning disorder, because of mental issues, this is the time to look into testing at your school. Most schools have testing, but you need to understand something. Their testing is limited. What they are generally looking for is something that would interfere with learning, like a learning disorder, ADHD, that kind of thing. If you are concerned that your child has a medical disorder or a mental disorder, school testing is not what you want to stick with. You're going to want professional testing by a psychologist at that point, or a psychiatrist. Psychologists generally do testing. And that is something that at the current time is usually not covered by insurance. You're probably looking at about a $300 thing at that point to get an entire spectrum of testing. And maybe at some point in the future that's going to be covered. I hope so, but a lot of people don't cover it right now. But I suggest trying to go ahead and do it. I know that's a lot of money and you might need to save up for it, but I suggest that you try to go ahead and do it because it would be worth it to have a definitive diagnosis, because then you can start a treatment plan. And a treatment plan might involve several things. In school, it might involve something called an IEP, which is an individualized educational plan. And what that plan does is it allows for modifications within the classroom that meet your child's needs. Like, for example, with my daughter, it included untimed testing. My daughter does not do well with timed things because, like a lot of autistic children, or autistic people, she's extremely deliberate and takes her time in looking at things and making decisions. So while she is amazingly accurate, she needs time for that accuracy. And rushing her gets her all confused and you know, it's just not a good thing for her. She has trouble with recall at that point. Because she's trying to do too many things and she's overwhelmed. She's flooded with information. So, an IEP is something that a child could have if their disability issue, whatever you want to call it, is not severe enough for an IEP. They can have something called a 504. And a 504 plan allows for some modifications, but not to the point, not as detailed as an IEP. It might be determined during this IEP that your child needs some resource courses, speech, maybe a special course for reading or a special course for math, and then they will come into the regular classroom for other courses. Education in recent times has really worked towards something called inclusion, which is something that it means that your child takes as many regular courses as they can. So that your child does not look like they are being sectioned out and away from, other kids. And also inclusion is a good thing because they get to witness other kids. One of the things that the specialized daycare did for my daughter was she got to watch other kids doing things, and it pulled her up. It pulled her up to wanting to try those things. So that was a good thing. So, early intervention, testing, that kind of thing. Now, that's talking about things that could help your child. Let's talk about you as the parent. Parents of special need children are superheroes. I am convinced of that because We deal with, oh, I didn't tell you the other thing that my daughter dealt with later on. At about 13 or 14, she developed extreme OCD to the point where we had to pull her out of school, and I homeschooled her from that point. But that's okay because I have a degree in secondary education. Um, so we had to get, curriculum and homeschool her at that point, and she did very well with that. She when she did her testing, she did very well with it. She has her diploma, so that can be done. But that in and of itself also involves things like, for example, if you have to quit a job, or you have to pay someone to come in and do the homeschooling. So yeah, it's not an easy thing. People who parent kids with special needs have a lot of balls in the air. They've got education, they've got appointments with physical therapist, occupational therapist, the doctor, the psychologist. All of these appointments have to be made, have to be seen. They've got medications that they need to keep up with that a lot of times their child can't keep up with. Now, my daughter is old enough now that she knows when and how to take her medication. So that has taken a large weight off of me. She's learned how to do her own laundry. She's learned how to fix her own food. Those are all things that could be taught in occupational therapy, or it could be taught in a support group or in a home for adults with special needs. That's one of the things they work on, is helping them learn how to do life skills. So all of those are things that parents are trying to keep up in the air. And it's hard, it's difficult. It is particularly difficult also if the parent is dealing with a health issue of their own, like maybe a chronic health issue, like maybe fibromyalgia or arthritis or lupus or any of these things. It's particularly difficult if the person is a single parent and they don't have another parent that they can rely on. There are feelings of guilt that parents deal with if they need the other parent to take over for a little while they rest. A lot of times the other parent is at work, and because a lot of parents of special needs kids, one of the parents has to quit work and work with the child, and that leaves the other parent doing the job, doing the bringing home the bacon, so to speak. And there can be some guilt from the parent who stays home. Also, it can be exhausting. It could be exhausting because you never ever want to show anger or frustration toward the child with special needs, because that child largely cannot help what is going on. I know sometimes people see kids having a meltdown in a store. I'm always very hesitant to judge that, because a lot of autistic children and a lot of children with sensory issues will get overwhelmed by lights and noise and other things, and they will have a meltdown. They just don't know what to do. They will just cry. And so, sometimes you have to deal with that. Sometimes you have to deal with emotional breakdowns as opposed to sensory breakdowns, just because the child is just tired of trying to deal with everything. I deal with that frequently. And again, you want to show patience, you want to show understanding, you want to help the child walk through whatever they're dealing with, because again, it's not their fault. But it is exhausting. And I have found, due to my daughter's particular issues with OCD, I have to be very careful what we watch and what we listen to, which means I have thrown a lot of things that I enjoyed watching out the window. I can't watch true crime, can't watch any movie that has any kind of violence in it or any kind of blood in it. Even if someone just gets hurt, like a split lip, we can't do blood. Spiritual things are an issue, so we can't watch things of a spiritual nature. My daughter, who is 24, watches almost exclusively Disney, and she loves Disney. And emotionally, she is quite young, probably 10 to 12 years younger than her chronological age, but her mental age is probably 50. She is incredibly brilliant. And so she has a dichotomy going that sometimes I have a hard time walking that tightrope in between those two. She's so intellectually mature that sometimes I forget that she's not emotionally mature. And sometimes I'm working with emotional immaturity and I forget how smart she is until she says something brilliant. So it's difficult, and there are a lot of people that have to walk that line. Now, I know some of you may have children who also have mental, intellectual disorders, and that's a little bit different and harder, I would say. But I know that some of you, especially if you have children who are on the autistic spectrum, you do have to walk in between what they can't do and what they can do. I try to push my daughter a little bit because she doesn't like to be pushed. She's very comfortable where she is. And I want to push her a little bit because here's the next thing that parents with special needs kids worry about. We will not live forever. I told somebody one time, I have to live forever. I'm just going to have to. I can't not live forever. But we're not going to. And we have to make some sort of long range plan, which my husband and I will be doing at the first of the year. We'll be trying to get my daughter on disability, which is something that parents might want to look into, so that there's a guaranteed income when you're gone. We need to look up setting up a trust and a trustee. We'll need to look up setting up long-term living arrangements. And these are all things that, because my husband and I are not getting any younger, as you can see, my wisdom hairs, because we're not getting any younger, we have to plan for these things. And I know every parent of a special need child deals with this. It doesn't matter if your child is 3 or 24 or 30. You deal with this, and it is emotionally, it's a very heavy emotional weight to carry. It is something that keeps you up at night. Sometimes it has me crying at night. So let's talk a little bit about self-care, because parents of children with special needs need to practice self-care. Now, I am a physician heal thyself kind of person where that's concerned. Last September, my husband handed me a receipt for 2 nights at a local very nice hotel, and gave me money to book some services at the spa that is attached to the hotel, and to have a really nice dinner at the very nice restaurant that's attached to the hotel. And this is, as you can tell, kind of a swanky hotel. And he got me 2 nights there, and told me to not answer the phone, that he had everything taken care of with our daughter, that I was completely... Now, I did call my daughter both nights and say goodnight to her so that I could touch base with her, because she is very, very connected to me. And so I did do that. But other than that, I watched all the true crime I wanted to, because I can't watch true crime with her around. I watched, let's see, well, basically I watched true crime the entire time I was there. I went to my spa appointment. I had a nice hot bath in the giant bathtub. I had a wonderful meal at the restaurant. And when I came back, I felt like I'd been gone for 5 weeks. I was so chill and so relaxed, more so than I had probably been in years, honestly. I know that that's not something that every person can do, but if you can, if you do have another parent in the household, just say to them, I need to go into our bedroom and shut the door for a couple of hours. Or I need to take a nap. I just need like an hour nap just to recharge. Or if our child gets up in the middle of the night and needs something, is having an emotional issue, could you take that and just let me sleep? Just something like that. Or if you're a single parent, which makes it so much harder, and I totally get that, if maybe you could have a friend just come to the house and stay for a couple of hours, and you get to either leave the house or go to your room and hang out. If you are a person that doesn't have a child with special needs, and you can do that, you have children old enough to stay by themselves, or grown children, maybe you could volunteer that for a parent that you know has a child with special needs. They would be beyond grateful to you. They would not probably even know what to do with that amount of time. I've noticed I'm looking at the timer more than I'm looking at the camera. Sorry about that. I don't know why I'm doing that. I don't like my videos to go over about 30 minutes, so I guess I'm staring at the timer trying to make sure it doesn't do that. But if you could do that for a person that has a child with special needs, that would be incredible. If you, a lot of times you wind up taking your child with you when you go places, and that's just kind of how it goes because they can't stay alone. They need to be with you, and maybe the other parent isn't available, or maybe there isn't another parent. And it's important that you find friends that understand your child's needs and understand what your child might do. Understands where your child might not be comfortable, and understands how to, they themselves will learn. They will learn. It's a learning curve, but they will also learn how to communicate with your child and deal with your child. And I have friends that are very good at doing that. They know Chelsea, they know her well. Oh, I just said her name, that's okay. They know my daughter, they know her well, they know how to talk to her, they know what bothers her, they know, and I'm very blessed in that regard. I've actually made some new friends, well, they're old friends that have become new friends. And they have been so, they ask what will make her comfortable, how's she doing, is there anything we can do, anything we need to adjust if she comes over. So, yeah, find those friends because those friends are golden. They really are. It's hard. It is hard. God does not choose everybody to be parents of special need kids. So if you have a special need kid, take some comfort in the fact that God chose you and knew you could handle it because he knew other people couldn't. And I just want you to know that if you're out there and you want to comment and ask me a question, feel free. If you are a friend on Facebook and you want to private message me, feel free. I don't know that I'll have the answers, but maybe I could direct you to someone who does. Or maybe you don't want answers. You just want to vent. Because every now and again, we just all need a good vent. So if you just want to vent frustration about dealing with the issues of having a child with special needs, or dealing with time management, or self-care, or that sort of thing, just feel free to vent to me. That's cool. That's good. All right, guys, I hope you're doing well. I hope you're staying safe, wearing a mask, doing what you need to do, because as a parent with a special needs child, seriously, you got to keep yourself healthy. I know it's hard, but, you got to do that. I want you guys to know that I am praying for those parents. I probably don't know you personally, but I want you to know there's someone out there praying for you. And I love you guys, and I hope you're doing well, and I'll see you next time. Bye.